Greetings and welcome, everyone. Welcome to a new episode of the Health, Wisdom, and Wealth Show, Powerful Conversations for Living Your Best Life. I'm Velan Hawkins, your host, and I've got an amazing gentleman as my guest today, Mr. Bill Cohen, and we're going to be in the conversation of dementia and caregiving, managing care, behaviors, and self-care. And Bill and I have been talking for a little while. I know this is going to be a great interview. But before we get started, let me just tell you a couple of things about Bill. He hails from the West Coast and is a certified senior advisor for this area of healthcare. His experience with his late mother guided him to take a holistic approach to advise and update family caregivers on how to be their best in caregiving situations. He's got a big heart, listens to their concerns, provides guidance, support, and referrals to trustworthy service providers. He coordinates and collaborates with support teams, and he's out to save the individuals who are in these healthcare situations, time and money. And he's been such a vital resource to so many people. And I'll let him tell you more about himself. But right now, let's get into this conversation and welcome, Bill. Welcome to the show.
Thanks, Velan. I've really been excited to join you here today, and let's get started on our conversation.
Awesome. Well, I always like to start off by asking the question, who are you and how did you get on this journey to providing such needed support for caregivers, especially in this area of dementia?
I love that question because I like to say that if you had asked me about 16 to 18 years ago, what was going to transpire, and I'd be sitting here talking to you today and doing what I do, I'd say, no way, couldn't make up this scenario. So even though I live on the West Coast in the Portland, Oregon area, I'm originally from New England. I'm a New Englander, but my mom was living in Biloxi, Mississippi for almost 30 years. And I'm working full-time in Oregon. She's starting to show signs of something. We weren't sure what, but mood swings, paranoia, not taking care of the house, not taking care of the finances. She was in the caregiver role for my late stepfather. And we were wondering, well, maybe she's just stressed out. Maybe she's tired. Maybe just getting a little older, right? So we thought if he passed away, because he was on hospice, she was in the caregiver role, or went into a care community, would she bounce back? We never got that opportunity because unfortunately, as I think you know, what happened in August 2005 on the Mississippi Gulf Coast and New Orleans?
Yeah, Katrina.
A home that had survived all the previous hurricanes, including Camille, for those who remember it. The house was completely swept away, right down to the slab.
Wow.
She had evacuated previously. She was safe, but she fully expected to come back to that house, and not seeing it there, the trauma exacerbated, accelerated whatever was coming on with her, whatever. We knew it was some kind of dementia. We weren't sure how bad. Long story short, she ended up evacuating with stepfamily to North Carolina. I started doing cross-country travel and long-distance caregiving, again, while holding down a full-time job, and started attending a support group, started started talking to a care community in Southwest Portland, where I wanted her to go if she could afford it and she can get in. And she was with other family members for a couple of years on the East Coast. I'm going to tell a quick little story, though, that illustrates what the disease can do despite our relationship. My mom and I were very close. She was loving, creative. We were very close mother and son relationship. Soon after the hurricane, she's in Wilmington, North Carolina, and she was very agitated. She was trying to exit. She was trying to escape. And fortunately, another family member says to her, Sheila, if you don't get back in that house, you're going to end up somewhere you don't want to be. Message was received. She still had enough cognitive ability to understand it. And that saved it. I was on the next flight back. The next day I arrived. She's fine to talking to me. She's happy to see me. And I told her, as I like to use the term, compassionate deception, not so much a white lie, but a little bit of deception. Mom, we're going to go see a new doctor tomorrow. Well, I was taking her to the ER to get admitted, to get some medication, calm her down, see a geriatric psychiatrist. I was in that ER and an adjoining conference room for like 10 hours with my mother, who was like a caged animal. The tension, the fear on her face was just unfathomable. I barely recognized her. But after she got checked in and got some medication, the next day I come off the elevator, she says, there you are, there's my savior. It wasn't me, it wasn't personal, it was the disease.
Yeah.
This is the kind of thing that the disease does to people with the paranoia and all kinds of other symptoms. And it was tragic. Moving forward real quickly, I moved her out to Oregon. She was less than a year in assisted living at the place that I wanted her to be. And she ended up in memory care for 4 years. And she passed away at age 83, 9 years ago today, early in the morning of February 4th. And I was with her at that time. 2 days later, I was in Costa Rica on a much needed vacation. She passed away just in time for us to go. And as I moved forward after I recovered, while I'm still working, I thought I was just going to do more volunteer work. I became the facilitator of that support group. I'm still leading it 16 years later. I'm doing the walk to end Alzheimer's, other fundraising, advocacy. And I thought I was just going to do more. And I discovered this concept of a caregiving support consultant and moved into what I like to say, I've turned my personal loss, my pain into my passion and my encore career as a Cohen caregiving support consultants. So that's a really long story, made as short as possible. But yeah, it was quite a journey with her.
Well, thank you for sharing that. It just goes to show how quickly this disease can show up and cause a devastating impact in the family, and then how long someone can last in the midst of basically declining. I had a good friend of mine. We grew up together. We met early in high school, been friends ever since. Her mom just passed away 2 days ago, dementia. But she had been declining for the last decade. Yeah. And my girlfriend was her caregiver. And I remember being in touch with her and she's just saying, you know, this is just, it's horrible. And so do us a favor and kind of walk us through some of the early warning signs, what to look for, and how to respond when we see those things.
And I'm going to even step forward on the respond aspect, that as soon as possible, if you see any of these things, is to either the person themselves or a family member get to a physician that has geriatric training, neurologist, geriatric psych, that type of person, a geriatrician, because the sooner that we can provide some treatments, even though there's no cure right now, and be talking about nutrition, talking about keeping active, we can possibly slow or delay the progression. And there are some conditions, and I should touch upon these real quickly, that things like dehydration, a urinary tract infection, polypharmacy, many medications, or mini strokes, TIAs, can present as dementia, but those are reversible. Another respect,
Okay.
if somebody is getting dementia and some of the signs which I'll talk about, we may not be able to cure it, but we can treat them and start trying to delay that progression. But it can be things like not handling normal daily tasks, making decisions, doing things mentally, cognitively that you used to handle easily before. I like to use the example is when somebody hasn't seen their family members in a while, which has happened a lot lately, for
Mm-hmm.
instance, at the holidays or some other family event. And let's say mom is a great cook. She's been making these recipes for decades, and suddenly it doesn't quite taste the same. Doesn't taste right. Like she left something out. God forbid she put something in there she shouldn't have, right? Or
Mm-hmm.
dad walks into the family room and just standing there has no idea where he is,
Mm-hmm.
or keeps asking the same question. When is so and so coming? When is so and so? Every 5 minutes. It
Mm-hmm.
can be you notice suddenly there are papers, magazines, unopened mail sitting on the counter, maybe even hoarding, possibly in the extreme. Or let's say you go out and look at their brand new car and you see dents and scrapes that weren't there before. Or you're out driving with them, they're getting honked at a lot. And they're saying, oh, aren't they being friendly? No, you just cut somebody off or went through a stop sign. These are some things to be watching for. My mom, when she was in assisted living, was quickly demonstrating most of the list of the 10 symptoms of the Alzheimer's Association, as on their website, alz.org. And it's a extensive list. So these are things to be watching for. And again, take action, have the conversation. Sometimes it's hard because family members, if not the person who's showing those signs, may be in denial. I'm fine, I'm okay, I'm just stressed.
Mm-hmm.
But those are cause for concern. But here's one quick example I love to use. It's not original, but we all lose our keys sometimes, or our glasses, or we can't find our cell phone, whatever. It's not a matter if you forget where the keys are, if you forget what the keys are for.
Mm.
That's a big difference. Or the
Yeah.
cell phone is in the refrigerator or the freezer or the
Yeah.
microwave. Yeah, you turn on the microwave and suddenly that cell phone's gone. That's not where you put a cell phone.
No, no. Yeah. Wow.
Mhm.
Well, thank you for that. Um, One of the things that I know is that, talk of dementia is all over the place, but really understanding what some of those early signs look like is something that I think that we want to stay in the shadows about, kind of the what you don't know can't hurt you, although what you don't know can hurt you.
Mhm.
Um, and it brings me to the place where I want to say that, you and I have been talking quite a bit, and I've heard you a couple of times talk about the fact that dementia is a woman's disease.
Yes.
And I've always been very curious about that. What is the biggest concern that you're aware of that supports dementia being this disease of and about women?
Mhm. Uh, a lot of it has to do with women tend to grow older or age and live longer, I should say. And so these things manifest themselves. But they've been so often in the caregiver role themselves and taking care of others. And as we were talking about a little earlier, not taking care of themselves, putting their needs last. And sometimes it comes down to even a simple thing like sleep or checking hormonal issues, things like that. These are some of the issues that a good, again, geriatric physician should be looking at for you and be watching for. I like to talk about that. Yes, it is a women's disease. The vast majority of the caregivers, the care recipients, and the professionals and service people are women. And my social media has 80 to 85% women. About 2/3 of the dementia caregivers are women, but then you take into the whole, everybody is involved with that. Because men are more and more stepping up into the caregiver role. It used to be like 1 out of every 5, now it's like 1 out of every 3, but it's still much more a women's issue.
Mm-hmm.
Now,
Mm-hmm.
I'd love to talk about that. We usually think in terms of genetics,
Mm-hmm.
and we talk about age. And those are definitely risk factors, especially if there's a family history. But in my family, no one else on my mother's side has Alzheimer's or even any kind of dementia, no worse than maybe mild cognitive impairment, the precursor. She was in her early 70s when she started showing symptoms, not very old. And we all know we're hearing about people in their 40s and 50s and 60s with early onset Alzheimer's. And that also tends to be more genetic. However, my mom is like a poster child for this. There is increasing signs that it's environment, lifestyle, and behavior choices that are higher as much risk factors as the others. And she used to live in Mississippi, as I said, toxins, pollution, chemicals. She used to smoke. She didn't exercise. She was in the caregiving role. She was socially isolated a few miles off the Gulf Coast. And as a master printmaker for over 30 years, she was etching into metal plates and putting them into an acid bath.
Ooh, those fumes.
Yes. So all those factors, maybe one, maybe a couple, maybe all of them together, are probably why my mom got Alzheimer's. But these are risk factors we all should be aware of. There's a lot of things that we can do that we can prevent and we can delay and we can lessen our risk to get dementia.
Awesome. You mentioned 3 things. Say them again. Environment.
Behavior and lifestyle choices, including, think about the old term, you are what you eat.
Mm-hmm.
There's some people call the stomach the second brain.
Yeah, it is.
And there's a very strong relationship between gut health, heart health, and brain health.
Absolutely.
And you may have heard just yourself that Alzheimer's is sometimes referred to as type 3 diabetes. And a lot of that has to do with the sweet poison, sugar.
Yes. Oh my gosh.
So there's actually an acronym where, and I like to use it because you can use it literally or the acronym, stop eating crap. The carbonated colas and other sweet drinks, added sugars, artificial and processed foods. And there's another acronym you may have heard, SAD, Standard American Diet.
It is very sad.
Right. So I highly recommend, and many people do, something along the lines of a Mediterranean diet or something similar.
Yes. Fruits, vegetables. And the beauty is that your body does have the ability to say, oh, I like that. Or, maybe not, let's not do that again, or so much of that. And it's about us retraining our brains to hear that. Because again, we think that everything happens here when we do have a heart brain, we do have a gut brain, and they are interconnected.
Yes.
My guest last week talked about Chinese medicine and the fact that, our body is a system of systems. And they all communicate with each other. And, for those of us who are caregivers at any stage of the game, we have to also look in the mirror and say, who's caring for me? Right? Be our own caregiver. And recognizing some of these signs and everything that you mentioned, stop eating crap and, put the sad to the side and go for the real food.
Real food, right. And that includes good fats and good carbs like whole grains and things like that. Some good fats are like avocado and olive oil and nuts and salmon and things like that. Exactly. And then self-care, you bring that up, is so critical. I like to say self-care is not selfish, it is vital. And it's important that you ask for help and you do take care of yourself first. It's the old oxygen mask analogy. Put the oxygen mask on yourself first and keep that in mind, because if you're not taking care of yourself, you're not helping anybody, including you or the person you're trying to care for. And unfortunately, with dementia care in particular, many other chronic illnesses, we talk about in terms of burnout, getting sick, or worse. Many, and I believe it's most a majority of dementia caregivers actually predecease the person they're caring for because they don't take care of themselves. That is tragic and preventable. So look for ways that ask for help from support from family, from friends, neighbors, ex-coworkers, nearby charitable or religious organizations. It may be somebody who can temporary stay for your loved one, adult daycare, where you can get a couple or a few hours or a weekend. Very important. You get that respite, you get that rest so you can take care of yourself, because the ramifications can be horrible. And if you think in terms of what I'd like to do, like get a massage or go have coffee with friends, you will find somebody, whether you volunteer or somebody you pay for a couple hours, a half a day, and all day. You're going to make that happen because you need to. You need to.
You really do. And, you know, we talked about it, and there are a couple of things that I want to really bring to the forefront for caregivers and for those who are seeking caregivers. You know, there's a balance. If I'm being cared for, I want to make sure that my caregiver is also taking care of themselves. And if I'm at the place where I don't have that cognitive recognition anymore, then my caregiver needs to know that that's really important to me anyway. And really taking care of yourself and asking friends, you know, when are you doing something? Let me know so that I can be involved. And, you know, I know you're taking care of your mom or whatever, and I didn't want to bother you. No, bother me. Let me know what's going on so that I can have that distractive self-care.
We all say things like, you know, how can I help? But too often the person says, oh, I'm fine, I don't need anything. Sometimes you just need to do something like bring them a meal, or go get your hair cut. I'll watch your partner or your spouse.
Exactly.
And what the caregiver can do is have a list of things, the things that they always take care of, whether it's picking up the laundry or doing some research or what have you, and say, can you do this for me? That's one less task that they have to worry about, so they can take care of themselves or take care of their loved one. And that's very, very important. So.
And I think, to your point, the whole asking thing, you know, I'm so used to doing it myself. I've always had to do it myself. I've always taken care of this and that and the other. And asking is not something that I'm familiar with or, you know, comfortable with. And we get to the point that no matter where we are, it's a health choice to ask, to learn how to ask, to recondition yourself, to make that unfamiliar space more familiar by asking for what you want and what you need. Exactly. So thank you for bringing that in. Let's talk about, you know, a lot of caregivers are also doing this as their business. You know, there's a lot of family to family caregiving, and there's a lot of people in the business of caregiving. And in your world of doing business and helping caregivers and manage themselves, what do you see as the number one challenge that these caregivers have, that they're moving with, as, you know, this is their mode of income, you know, and they're looking at, what is it going to cost if I have somebody help me? And, you know, some of the things that entrepreneurs actually deal with, and someone who's a caregiver, and this is how they make their living. There's a lot of similarities to the family caregiver, but there's a lot of differences too. I mean, the level of stress, because I'm running a business, got to do the books, and, you know, what's the number one challenge that you see that some of these caregivers have?
Well, part of the problem, and of course, there's a lot of training involved to do it, probably to be an aide, a companion, it's TNA, a nurse, whatever, that the biggest issue is, and this is what a lot of agencies and care communities are dealing with, it's hard work, it's a labor of love, they don't get paid much. And this is part of the problem with the system, is that what the market will bear, so to speak. the costs are going up in order to find enough people and people that are trained well to take care of. Because one thing is companion care, where just taking them for a walk or going to get their haircut or making sure they eat or take their meds. On the other hand, getting into real care is very involved, and it takes a lot of patience and training, especially dementia care. So until our bigger picture than us, like the government or insurance companies, whoever, come up with a better way of funding our healthcare for a crisis that's getting worse, as especially the baby boomers are moving into that age group that needs more care. We don't have enough people to take care of them. Going to the family caregivers represent like over $250 billion of unpaid care. What if they weren't doing that? We don't have enough people, enough money to take care of the people who need it. So we've got a real crisis that's getting worse and worse. And until leadership says, yes, we need to take care of our elders, we need to take care of our seniors, we need to take care of the people, take care of them, we do have a problem. Now, when it gets into the actual people doing it, you have independent caregivers, and then you have agencies which hire them. And then there's actually some hybrids in there where they're kind of like coordinating the independents. Independents tend to be, they'll be the ones who would be the 24/7 care. They will live in your home. They're going to be, should be licensed, bonded, insured, well-trained, that type of thing. They probably per hour are going to be less. Problem is, something happens to them, you don't have backup.
Mm-hmm.
With an agency, and it may end up being a couple of different caregivers that are doing different shifts, at least you know that they've been licensed, bonded, insured, cleared, trained, compensated, and if something happens to one of the caregivers, they have somebody else to help out. But again, this is a growing crisis, and until we come up with some better funding sources, it's not going to get it much better.
Mm-hmm. It's really interesting you bring that up, because I've had a lot of conversations about the healthcare system ship and what it will take to change the direction of the ship. And I have to admit, in some instances, it is shifting, but it's shifting very slowly, and it's shifting with, I want to say, without the consideration maybe of where the emphasis should be placed in caregiving, in health.
Right.
And it used to be about preventative medicine. It used to be about, if we can't prevent this from happening and it happens, then we move into this. And we've gotten into what I call the cycle of, you're in with something sick, and now you're in a sick care system,
right,
versus health. And so what would you tell our audience about how they can step up and be more proactive in this space of turning the ship? Maybe taking responsibility for their own health, for speaking up about what they've experienced, sharing. What would you say?
Well, I think you hit the nail on the head right there. It is personal responsibility for your own health. Is part of it. I'm not the first one to say that we have a slow growing pandemic again. Of how would we have been in this last couple of years if we were a healthier society, where people were watching their salt and sugar intake, their just the total calories, the portion controls are ridiculous. But also to educate themselves, be sharing what's going on with them. Don't hide it. Don't shove it under the rug. But when you've got an issue like diabetes or dementia or other chronic illnesses, talk about it, educate others, so there isn't that stigma. We don't just hide it away. Mental illness is another one, of course, we know that, but also to advocate with your legislatures, to complain to your healthcare companies, your systems, say, this is wrong, this has to change. You're not providing the care, you're not providing the wellness, the prevention, these things. You're only handing out bills and doing surgeries. It's interesting. I always think back to some of your listeners may remember the program Northern Exposure, where they had the doctor from New York working in Alaska, and Adam Arkin played a kind of like a Renaissance man, and he said to the doctor, said, "You AMA clones are all like, all you do talk about is surgeries and pills.
Mhm.
Where's the wellness? Where's the prevention?" I always love talking about that. I also think back to the original Star Trek. It always seems to go back to that because it was so philosophical that McCoy, Bones, and he
Uh-huh.
was talking about like our time period, the 60s, 70s and beyond, that looking back at our medical care, he says, what barbarians. Look at what we're doing, right? And it's so reflective of what's wrong with our system.
It
That it
is.
is, as you said, a sickness system, not a wellness system. So we need to be advocating, we need to be talking to our legislatures and the other decision makers. There needs to be leadership. Where that's going to start from, I don't know, because I know it's not coming from certain sources that they should be.
Absolutely. And for me, it is also about supporting those who are advocating, because what you said may sound to some to be such a daunting task. It's like, well, I've got to find out who to contact. I've got to, it's connect with an organization that is already doing it and be a part of it. But you also want to show up and tell your stories and have your voice and add to the collective, because just saying that I'm supporting them isn't quite enough.
Mhm.
It's more than a say, it's a do.
Exactly.
And I so appreciate
Yeah.
all that you brought into this conversation today, Bill. As we're wrapping up, let me ask you one big question. I mean, you've shared so much wisdom and insights, and this has been such a great conversation. But is there some really big piece of wisdom about dementia that you feel is important to share in the short time that we have left together, that you want to make a positive impact on our audience?
I could say so many things. I think would be, and we touched upon this briefly, is to inform yourself, be aware, educate yourself, go on a great resource, which was one of the first things I did when I realized mom was struggling and something was wrong, is the Alzheimer's Association. They deal with all forms of dementia, because dementia is the umbrella term. Alzheimer's just one type of many, dozens, if not over 100, at alz.org. alz.org.
And
Wonderful resource with education, support groups, fundraising about the research, and they are the largest nonprofit source of funds towards research in the world after the United States and, believe it or not, China. So it's a
awesome.
wonderful organization. That's why I got involved. And it's been a great experience as a facilitator, as a fundraiser, a volunteer, and I go to our capital as an advocate. So, but then take that, look at the site and learn that it's not something to be so much scary, that there's a lot of things we can do, again, to help ourselves, help our loved ones. So it doesn't have to be necessarily a death sentence or something that happens really quickly and horribly, but maybe we can preserve something, because the symbol in my background is the purple flower from the walk, which means that I lost a loved one to dementia, to Alzheimer's, again, my mother. But there are other flowers like you're supporting or you actually have it, but we're looking for the white flower, which will mean we have the first survivor. Or you said it's reversed, we've stopped it. That person will not die from Alzheimer's. That's what we're all hoping for. So the more the people can be aware, get involved, be involved with the walk or some other form of education and advocacy, it would be wonderful.
And remember, it starts with prevention.
Yes.
To know what it is in order to know how to prevent it for yourself is key. Thank you, Bill. This has been really informative. And to our audience, I will share how you can connect with Bill, an amazing resource. And, like I said, supporting those who are in these spaces, find ways to support Bill. His work is so critical. And
And
we will post.
I do help families all over the country.
Awesome. Awesome. And we will also post the alz.org link and share this information. Do us the favor of sharing the link to this video to your family, friends, anyone who you know that this information might benefit. And we're here to help. This show is all about powerful conversations for living your best life and helping others to do the same. And thank you, Bill. Great to have you on today. I appreciate you.
Thank you. And thank you for helping spread the message and spread the word. It's been an honor to be here.
Absolutely. All right, everyone, we've got some exciting things coming up in future episodes and more. So do stay tuned, turn on your notifications, like us on Facebook, subscribe to our YouTube channel, and share. Do us the favor of sharing this video and any others that really pique your interest. Thanks, and until next time, remember, be well, live, love, and be a bigger positive impact in your world. And we'll see you next time. Bye for now.